Welcome to the Community Spotlight Podcast. Our guest, Kate Siefert from the Crawford County Public Health. Welcome to the podcast.
Thank you. Thank you for having me today.
You know, I just got to thinking, did I ever interview you back in the old days with the, I never did.
I don't believe so,
No,
no.
back when they had the actual Spotlight program. So this is the first I've actually interviewed you, although we talk all the time.
We do talk frequently.
Yes, and it's all enlightening conversation. So that's what we're going to do today is have some enlightening conversation about the Crawford County Public Health. This time of year, I'm sure the first thing that enters my mind is, golly, aren't we getting close to being in flu season?
We are getting close to being in flu season.
All right.
Yeah. So, and actually in Ohio, it's recommended that you get your booster every year, ages 6 months on up. October is kind of like the perfect month to get your flu shot because they last, they're most effective, last about 6 months. So that will get you through the entire flu season if you get it in October. And you want to make sure you do it early enough that you have 2 weeks to build up your immunity before you start being in large groups with other people and going into the holiday season and all that. Yeah. So we are excited to let everyone know our annual drive-through flu clinic, which is very popular, has already been set. It's October 11th, which is a Wednesday, from 3 to 6 p.m. out at our office. So we are located at 1520 Isaac Beale Road, and people can just pull in and roll down their window, fill out some paperwork, stick their arm out the window, and we'll get them their flu shot.
Okay, I just want to say something quickly here. 1520 Isaac Beale Road.
That's correct.
Now that is in the, was it the former Baja headquarters?
We are in the former Baja building.
Okay, I'm a person that I don't read street signs. I go by, you know, the rock on the side of the road. That's where I turn.
Yeah, we're on the corner of Beale and Isaac Beale, kind of catty corner from the airport.
Yes.
So we're pretty easy to find, easy access with our driveways. And, you know, a couple times we've had the EMA office come out and test us and like time us to see how well we are at moving people through the drive-through. And most people are there for less than 5 minutes.
Again, why don't we give that date again? And it's the drive-through flu clinic.
Yeah,
correct?
It's one of our most popular clinics every year.
Okay, give that again.
It is Wednesday, October 11th, so just a few weeks away, and it's from 3 to 6 in the afternoon.
3 to 6 on October 11th.
Yeah, and we'll have 2 different kinds of flu shots available. We will have your standard quadrivalent flu zone, so that has protection from 2 types A and B each, and that's recommended for ages 6 months on up. And then we'll also have the high dose for those ages 65 on up, which has 4 times the antigens.
Okay.
So a lot of people are recommended by their doctors to get the high dose, and we do have that available this year.
So what you're saying, and looking at a young person like me, I need the high test. I guess that's what you're really saying, but I appreciate that.
I'm not too far behind you. It's okay.
Oh, okay. Got to have a little humor in here, folks, because this is a pretty serious topic. COVID. Where are we at on boosters on them? There's always something going on with COVID.
There's a lot of confusion with the boosters this year.
All right. Well, then let's.
Yeah. So, and unfortunately, I don't have good answers. So we do not know when our boosters are coming in. We have ordered Moderna.
Okay.
We carried Moderna through the entire pandemic. We had a couple weeks of Pfizer. But the logistics of handling the Moderna are much easier. So that's what we prefer. And that is what we have ordered for the new updated shot. But we have not been notified when we will get it. Yeah. It is also not free anymore, and we have not been able to run it through the systems to make sure all the different insurances that we accept will cover it fully. They tell us it will, that it's supposed to be fully covered by insurance, but we haven't had the opportunity to test it yet. And I just want to let people know that because I don't want them to.
Well, they get frustrated because they're going to say, well, why? You're the health department. You don't even know. But the fact is you don't know because you haven't been told.
Yes.
You haven't been told,
and
officially told.
And we are very frustrated, too.
And so I'm just trying to the public needs to, I tell people they need to be a little bit more patient because people make a lot of assumptions about things that they don't know the inside or the internals of this.
Yeah.
And you're dealing with a lot of agencies and things, and they say, you're going to get this and that, and then the next thing you're not getting it quite when it was there, and then, quite frankly, sometimes you look, a little foolish because you're thinking something's gone somewhere.
Yeah, I don't want to make false promises,
Right,
so we're
right.
not. So we're just letting everyone know, yes, we intend to carry it. We would like to. We don't quite know when. We'll be updating people and letting them know when it does come in.
And then that will also be, I would take it on your website. That's a good thing for somebody.
And on our Facebook page as well, Crawford County Public Health. You can follow us on Facebook. We do daily posts and try to get information out to people.
Okay, so I was going to say this way that if you say, boy, I'm interested, but they're not, it's kind of about as clear as mud what they just told us here on this podcast. Well, we just really don't know right now. So probably your best bet is going to go into, again, give those again, the web page. Was it that where you went to?
CrawfordHealth.org.
Okay.
And then if you follow us on Facebook, look for Crawford County Public Health.
All right, and that will have all the updates, and as soon as this gets cleared up a little, where we can
Hopefully
actually see.
soon.
Hopefully soon.
Yeah.
It'll be on there, and I'm sure we'll have something here on the station as well about it.
Yeah, and we do want to let people know, too, when we do our drive-through flu clinic, we won't be doing COVID also. Even if it does come in time,
Okay.
that will strictly be a flu shot clinic so that we can keep it moving and we don't have
Yes.
a traffic jam and all that. We're going to stick to the flu shot for that.
Well-
Some people might need to get their pneumonia shot. We can put that out there, too, but not the COVID. So
Okay.
that one takes just a smidge longer to administer, and so we don't want to do that at the same time we're trying to move
No.
people through quickly with their flu shots.
Nothing worse than more confusion in a
No.
situation that's already can be confusing.
But we offer clinics year round. So every Thursday at our office is clinic day with our nurses. And at least twice a month, sometimes more, but at least twice a month we'll have late clinics so we can catch people after work, and we're there till 6:30, 7 o'clock at night.
See, and that's good too. I mean, that the times are very good that you can do this. Now, speaking of COVID, we're talking about what about test kits?
Yeah, so we do have some test kits in our lobby that are free. People can just come out anytime that we're open and pick some up. Those will expire at the end of the year. So if they want one like right now, they're welcome to come out Monday through Friday, 8 to 4:30 when our lobby doors are open and grab test kits. They're in the lobby door. You don't even have to talk to anybody. Just come in, grab some kits, walk back out. We don't care. But there's also, beginning September 25th, became available. You can order through the federal government 4 free test kits per home. And you can either go to the website, the covid.gov, and search for the free test test kits.
Easy for you to say.
I know. Or you can go to the USPS.com website and look for the free test kits order form and sign up for your 4 free test kits. Test kits. I keep saying kits. It was our Facebook post yesterday, so that's another reason. I like people to stay up with us on Facebook. When I get that information in, I can immediately send it out and let everybody know.
And another thing too is if they miss something even on this podcast, they can replay the podcast.
That's right.
That's as well. That's just as well. But we're just trying to make sure that people have many avenues so they can review and go back, because sometimes we have to cover just because of time. Nobody wants to sit here and listen to us for 3 hours. We have to make things somewhat brief just to whet your appetite and say, hey, take some action.
Yeah.
Okay.
So now the test kits, a lot of people ask us, do I have to tell you what my results are? No, it's okay. But I want people to use those to make good decisions.
Yeah.
So
an uninformed person is going to do you no good in this. You have to, once you know, then it's up to you to take the action.
That's right. So use it as a tool. That's what it's there for.
Yes.
And, this time of the year, there are so many respiratory viruses floating around out there that it is good to know what it could and could not be, so that you can make a good decision with your own family and what you're going to do, and then possibly follow up with your doctor, hopefully.
Okay, I'm going to segue into something a little different, in fact, quite a bit different. Help Me Grow.
Help Me Grow, yeah. So one of the divisions at the health department includes our Help Me Grow, and they have their home visitors that will go out and interact with the pregnant moms, and we like to enroll the families while they're either pregnant or up to age 3 months after the baby has arrived. So it is an amazing service for people, especially if it's your first time baby. Those social workers that visit, they are so well trained on helping with pregnancy, helping with early childhood development, parenting, They've got all kinds of like tricks and tips and techniques up their sleeves, and it's just so reassuring because you just, as a parent, it's one of the hardest things you ever do. You never know if you're doing it right. And you're always worrying every little move that you make. Should I feed them this? Should I not feed them this? Should I do this? Should I not do that? And our social workers are amazing home visitors. They come to you. They answer your questions. They carry their work phones. They are texting all day long with their parents and their families and helping them out. I wish I would have had it when I was pregnant with mine, but they're amazing. So we have openings. So we usually carry a caseload of like 100 families in the county at a time. But when they hit age 3, they age out. And then we have openings. So we currently right now have had a lot of 3-year-olds that exited our program, and we have some openings. So it's a great opportunity for those pregnant moms out there, or if they just had a baby, to reach out to our Help Me Grow division and see if they can sign up. It's free. It's voluntary. And they just provide tons of resources. They can help you get connected to pediatricians. They can help you when it is getting closer to age 3, how to get into preschool and answer all those questions. And they bring lots of goodies too. Wow. They can help you with activities that you can do at home to keep your child engaged, free things. They also will have family connection nights. And so all the families will come together with all these little ones, and they'll just have a good time, have some food, some fun, and you get to interact with other parents of children about the same age. So they're an amazing group. Yeah.
Well, right now I'm going to be kind of like a guy on the 270 outer belt in Columbus that he's going to realize that he might not be quite getting his exit that crosses 5 lanes on you and that you could yell at. I'm going to segue to something a little different. I thought we had mentioned a little something off air about Lyme disease. What's going on with that?
So yeah, Ohio is seeing a great increase in Lyme disease. So Lyme disease is transmitted to humans through an infected tick, the deer tick, which is really teeny tiny, like teeny tiny. You won't know it's on you. And it has the disease in it. And unfortunately, it can cause long-term chronic symptoms. And since it's kind of new to Ohio, it's not always on people's minds as to when it's time for diagnosis as to what's wrong with them. So you can have fever-like symptoms and flu-like symptoms. You can have achy joints. There's a whole gamut of things. Sometimes there's a bullseye rash at the tick bite site. The tick might have already fallen off, and you've got this rash, and it's the shape of like a bullseye, like a dartboard type of a circle.
Right.
Yeah. And but that's not always the case. It can cause drooping on the side of the face, even. Yeah, so it has this weird wide gamut of symptoms, and we're really seeing a spread in Ohio. Already this year, it is the most cases in humans that Ohio has ever experienced because the tick is moving.
It was probably a good year for them.
It's been a wonderful year for ticks. Yeah. Ticks and mosquitoes both. It's been a wonderful year for them. So it's just something I want people to keep in their minds is to, if they're having symptoms and it's unsolved and they just can't quite figure out, just keep in the back of your mind whether you might have been out and about and gotten into a tick, and if Lyme disease is a conversation you want to have with your doctor.
Kate, any parting thoughts here this morning? Anything else maybe we should have covered that we didn't?
Well, it's, I know people don't like the word COVID, but let's just say it's virus season.
Yes.
And really it doesn't matter if it's COVID or flu or cold or strep throat or norovirus. It doesn't matter. It's virus season. So it's still good to remember all those things, all those basic things that we go back to. Good hand washing goes a long ways. Covering your coughs and sneezes. Wiping down your surfaces, and then if you are sick, stay home. That's right. Those are simple things, basic things, but they go a real long way in preventing the spread of disease.
All right. Well, on that thought,
wash your hands.
We will wash your hands, and at this point, you get to wash your hands of me.
Okay.
All right. So
good to see you.
Oh, always good to see you. I want to thank again Kate Siefert. You're officially the health commissioner?
That is my title,
the
health
official
commissioner,
title.
so.
I should give you your official title. She's the health commissioner.
I'm a public servant.
Okay, with the Crawford County Public Health. for being the guest today on the podcast.
Thank you for
I
having
always
me.
enjoy your enthusiasm, and we get into a lot of topics real quick here, but that's fine. That's the way we want it.
Yeah.
And again, if you have more information, you can go to their Facebook page and to the web at crawfordhealth.org.
Yeah, and I'm going to throw out our phone number too. So if
Sure.
they want to call and schedule an appointment for whatever reason, it's 419-562-5871.
All right. Or when I went to school, 419-562-5871. We don't run the numbers. I'm having fun with you today. Hey, thanks a lot, Kate, for being on the program.